My name is Rachel McGuigan. I'm the owner of Trinity Physical Therapy. I specialize in craniosacral therapy and visceral manipulation, and I am a chiropractic advocate.
Hi, my name is Robbi Knudsen. I'm a chiropractor in Omaha. I've been practicing for 26 years, and I see little babies all the way to elderly, and I love helping all people feel better, function better, and I am a strong physical therapist advocate, and I've seen Rachel regularly for years. I think it's a perfect blend with chiropractic care when it comes to manual therapy, soft tissue work. Those two together, chiropractic care provides joint manipulation, adjustments that help to restore motion, and physical therapy helps to rehab those muscles, strengthen them, restore proper motion, working on all of those other things. We just work together really well.
Because I feel like sometimes there are just things that I can't quite get to. With the techniques that I use, I'm working with the connective tissue a lot, and sometimes those joints need to get moving just a little bit better. And Robbi does that kind of stuff all day, every day. And so a lot of times I'll send people to her when they're having problems with that joint mobility that just doesn't get resolved with the exercise, the manual therapy that I do, that's mostly focusing on the soft tissue and the joints in just a little bit of a different way. I particularly like treating people who are seeing a chiropractor, particularly Robbi, when they're having a hard time getting their adjustments to stick. I find that when we get in there and delve into the connective tissue and release that, then they get a better result at the chiropractor.
Absolutely. And as a chiropractor, especially with Medicare patients, my job really, and what I'm paid for, is to provide chiropractic manipulative therapy. That's what Medicare reimburses for. And what I think my patients, that are older, need is more strength, balance, coordination, rehabbing those joints, and I can't provide that for them in office. I'm not going to get reimbursed for it, and I don't have the space and the time to do it for them. Well, usually they're coming into me with a complaint. Hey, I fell last week. Now pickleball is the new thing. So everyone's coming in with injuries. I hurt my knee. Well, great. I can work on figuring out, hey, what's the problem with that lower back? Maybe why isn't that hip working? What's going on with the knee? Is it an ankle? But as far as rehabbing and teaching them how to strengthen the muscles that are weak, that's where physical therapist Rachel is going to come in and be able to provide that for them.